Hi everyone. In my previous video, I have been talking about the PGT testing a couple of times, and in this video, I'll be covering about PGT as well as NICS. PGT is pre-implantation genetic testing, and NICS is non-invasive chromosomal screening. So, actually, what are these tests for? So whenever embryos are formed, there can be of good quality embryos or poor quality embryos. And even though the embryos are of good quality to look at, there can be chromosomal abnormalities in the embryo. And that's where our PGT or NICS will help us. If there are any chromosomal abnormalities in the embryo, it can lead to either implantation failure, or even if it gets implanted, there can be miscarriages before third month of pregnancy. And these tests are done on the embryo to detect whether the embryos are euploid or of aneuploid. Euploid is when there is no chromosomal abnormality. Aneuploid is when there is chromosomal abnormality. So with the results of these tests, we'll be able to filter the embryos which are of euploid, and when we transfer these euploid embryos, the chances of implantation and pregnancy will be high, as well as the live birth rates will be high. So next thing is it necessary that every patient who undergo IVF treatment have to get these tests? No, it is not necessary. There are few indications where we advise these tests for the patients. So number one is advanced age. When the age is advanced, there can be more chances of chromosomal abnormalities. Number two is previous history of recurrent implantation failures. Number three is previous history of recurrent miscarriages. And number four is severe sperm factor. Next thing is which is better, whether PGT is better or NICS is better. So first coming to PGT. In PGT, what we do is we'll collect few cells from the embryo and then we'll subject it for testing. Whereas in NICS, this is a non-invasive chromosomal screening. Here we will not disturb the embryo. Instead, we collect the media where the embryos are grown, and we collect DNA from the media, and then that is subjected for the testing. Because PGT is invasive test, here we need very much skilled embryologists to collect the cells, because while collecting the cells, embryo should not be disturbed. Otherwise, there can be damage to the embryo which can cause the loss of embryo. Whereas in NICS, because it's a non-invasive, the risk of damage to the embryo is very less. Otherwise, the results of both the tests are almost same, and you can opt for any of the test. Thank you.